Hello everyone, welcome to my channel Biomed Prachi. Today we are going to touch a very common aspect of medical field. So today our topic is medical implants. Before starting, subscribe to my channel so that you will be connected for every new topic. Basically, implant is a medical device used to replace a missing or defective biological structure to support a damaged biological structure or to enhance an existing biological structure. Nowadays, implants have become a common thing in human life. For example, your tooth cap, artificial knee joint, eye lenses, heart valves or pacemakers, some ear machines, some metallic structures in case of fractures and many more are there. So today I am going to introduce you those different types of implants and I am going to tell you of what kind of materials they are made. All implants are made up of some special biomaterials and are grouped in types metals, ceramics, polymers and composites. Today, medical field and biomedical field has achieved a tremendous height in research and development area of medical implants. There is a vast range of biomedical implants. One by one, we will see different kind of implants. All medical implants are regulated and classified in order to ensure safety and effectiveness to the patient. So first type is artificial joints. These kind of implants are mainly used in hip and knee replacement, wrist and elbow correction, sometimes artificial shoulders also. In case of artificial joints, biomaterials used are metal alloys, ceramics and polymers. Implantable metal alloys are stainless steel, titanium alloy, cobalt chrome alloy and tantalum. Metal has the mechanical strength and stiffness necessary for load bearing. Calcium phosphate bioceramics are used to enhance the biological features of metallic implant. Ceramics are generally porous in nature, so they enhance the elastic modulus of implant and enables osteoblastic cells to grow into the pores of implants. As this process anchors the cell into implant, it increases the strength of bone implant interface. In next step, anti-infective biomaterial have become the primary stage to prevent implant-associated infections. For this, nanocoating of thin layer of silver is done in form of nanoparticles, and then polymers are used on those metal processes which exhibit low frictional effects. So for artificial joints, metals, ceramics and polymers are used in this way. Second type is breast implants. Breast implantation can be done for reconstructive purpose such as after mastectomy for breast cancer or for cosmetic reasons also to enlarge the appearance of the breast through breast augmentation surgery. There are different types of breast implants defined by their filler materials are saline solution, silicone gel, structured and composite filler. The saline implant has an elastomer silicone shell filled with sterile saline solution during surgery. Silicone implant has an elastomer silicone shell pre-filled with viscous silicone gel. Then structure implants use nested elastomer silicone shell and two saline filled lumen. And then alternative composition implants featured miscellaneous fillers such as soya oil or polypropylene string. Then complication of implants may include breast pain, infections, ruptures, cosmetic changes to the breast such as asymmetry and hardness and the fluid collection around the breast. So this is done for breast implants. The next type implant is cochlear implants for ear. Cochlear implant is a device that improves hearing and it contains electronic circuit. Cochlear implant bypasses the defective area of ear and delivers sound signals directly to the auditory nerve. So main biomaterials used for those implants are silicon, ceramic, titanium and platinum. For cochlear implant, transmitter coil is should be in silicon sheath. Electronics enclosed in titanium casting and then electrodes with platinum contacts in a silicon array and the cable should be of silicon type. Next implant is intraocular lenses. Intraocular lenses are tiny artificial lenses for eyes. When natural lens is removed during cataract surgery, then intraocular lens is get implanted. Most intraocular lenses are made of silicon, acrylic, and other plastic compositions. They are also get coated with a special material for UV safety purpose. After that, we will see pacemaker implant. There are different types of pacemaker. Today, I will introduce you implantable pacemaker. Pacemaker is a device that regulates irregular heartbeats. That is, if someone have heart problems of arrhythmias, then pacemaker helps heart to beat in a rhythm. For more information about heart problems and machines you use for that, I have given a link in description box. You can visit the channel. Casing of pacemaker is made up of metal like titanium because polymers have also a critical material for pacemakers. Blood compatibility is one of the major criteria which limits the use of biomaterials for cardiovascular applications. Metal lead of pacemaker is made up of metal alloy but is insulated in a polymer such as polyurethane. The circuit is usually made up of modified silicon semiconductor. For pacing leads, materials are generally used are composite wire conductor strand consisting of thick, strong body of molybdenum 35N or titanium which has been filled with a center core of low resistant metal silver and encased in shell of platinum alloy. Then our next implant is orthodontic implant. Orthodontic implants are tiny implants that are used during orthodontic treatment anchors to move teeth. Moving teeth face difficulty when there is no support. In such cases, orthodontic implants are being useful. For orthodontic implants, titanium and its alloys are mainly used. Zirconium is also a metal which demonstrates adequate toughness and strength. This zirconium also possesses a zero risk of corrosion. Nowadays, zirconium is becoming more popular than any other metals for orthodontic implants. Next is prosthesis. It is a device that replaces a part of body such as artificial leg, arm, fingers, etc. or any other artificial organ. A huge list come under this prosthesis thing. Prostheses are made up of combination of different sized and different shaped pieces made by different materials. In those fracture plates, screws, hip nails are made up of stainless steel. Prosthesis stem, load bearing components in total joint replacement are made up of cobalt, chromium, molybdenum alloys. Hip and knee prosthesis screws and pins for bone fixation are of HA coated titanium alloys. Some prosthesis stems are made up of titanium alloys. Then internal fixator for long bone shafts, spinal correctors, vertebral spacers. Anchoring of prosthesis and staples are made up of nickel and titanium. Then orthopedic load bearing applications are made up of high alumina ceramics. Then alveolar ridge augmentations, otolaryngological coatings for tissue ingrowth, maxillofacial reconstructions are mainly made up of partially stabilized zirconium. It is best known among all ceramics and being both hard and fracture tough at room temperature. It is, in short, it is called as PSZ, partially stabilized zirconia. Then middle ear reconstructing junction of spinal vertebrae are made up of bioglasses. Then next is intrauterine contraceptive devices. Intrauterine contraceptive devices are used to prevent pregnancy. IUDs are made up of molded plastic. One type of IUD releases a progestin hormone which prevents pregnancy. The other type is T-shaped and has a copper wire wrapped around the base and on the arms of the T. In this way, I think we have covered most of the medical implants. Thank you so much for watching till the end. Next time we will see a different topic. Till that, keep learning, do your best. Bye bye.